Good afternoon, and thanks for joining us for today's Healthline 3. I'm Courtney Butts, and today we're talking all about the eyes. And joining us to talk about this is Dr. Wyche Coleman III and Dr. Christopher Shelby. Thanks for being here.
Yeah, thanks for having us.
Yeah, always good to be here.
All right, yeah, Willis-Knighton Eye Institute is where you guys are, and you've got some big news that is, it's somewhat new, relatively new news as far as your new operating center.
Pretty new, so it's the same space that we've been in, but for about 30 years, it was, and we do almost exclusively eye surgery there, mainly cataract surgery, but for 30 years it was basically unchanged. And so we've sort of done a ground up, down to the studs remodel where we've got a cosmetic remodel, so it's a very modern space now. We've also added some functional changes on the way that the workflow goes so that we can more efficiently move people in and out, so the wait times are reduced. In the past, we had 3 operating rooms with a little bit different equipment in each of them. 2 of them were the same, 1 of them was a little bit different. Well, now we have 4 operating rooms that are identically equipped. So we can do anything we need to do in any one of the 4 rooms. So that basically just helps with efficiency, because with cataract surgery, the rate limiting step is basically the time between getting someone in and out. Doing the actual cataract surgery takes 5 or 6 minutes for a normal cataract surgery. Some of them are more complex and takes longer, but that's about the average. So really it takes longer to move someone in and out of a room than it does to do the actual cataract surgery. So having more space enables us to move faster.
Right.
And just not have wait time between cases, so we can walk directly from one and start the next one. So that just improves the patient experience. And then we don't necessarily have to say, this person has to go in like room 1 or 2. They could go in any of them, and because we have the same exact equipment set up in all of them. And it's, from a technology standpoint, the operating microscopes we use are state of the art. They're as nice as they get in the world. We don't look through physical oculars, like looking through a pair of binoculars, which you normally do, look through an operating microscope. Now we use 3D glasses and we look at a 3D TV. So you basically plug a 3D camera in where you normally look, and that enables us to get a better view than we've ever had before. The people who are assisting us have the same view that we have. Just helps them sort of be on the same page with what's coming next and what's happening in the surgery. Makes it a little bit more seamless. It's a more comfortable position for us to sit in, and so generally it's a more advanced way to do cataract surgery. Now we have that in all 4 rooms. They're identical. We have the equipment that measures the eye. We have the equipment that to have better refractive outcomes. Some people need to have their eye measured during cataract surgery. Once the cataract is removed, before the new lens implant goes in, there's a system called the Aura system that takes a measurement of the eye. We don't need that on everybody, but for some people we need it to help refine our outcomes and make sure that we have the highest probability of leaving them glasses independent after surgery. Now we have that in all 4 rooms, identical system.
Nice.
So it's a better patient experience. It's excellent technology. I say it all the time. If you went to Harvard or Yale or someplace where they have unlimited money to spend, you wouldn't find a nicer setup for cataract surgery than we have right here at Willis-Knighton in Shreveport. It's as good as it gets. We're really lucky to have it, and so we've been enjoying operating in the new space. I think that people who come through will enjoy it also. We're having a little open house to sort of showcase it and get a little press on November 19th.
Okay.
So, but it's a super nice facility.
It's Tuesday.
Yeah, you should come.
Yeah. All right.
You should come. You're invited.
Oh, well, I appreciate it.
It's
Thank
like
you.
3 o'clock on Tuesday. Why don't you come cover it?
Oh yeah,
It's a great
I'll
idea.
see if I can. Well, I anchor at 3 o'clock.
Oh man.
Yeah.
Well,
You could anchor from there.
Yeah.
Well, no, I guess you can. Yeah.
TB determined.
TBD. Okay,
TBD, that's
we're on the
right,
fly here. So
Yes.
anyway, that's our newest thing, and I think it's great. I think it's gonna it really enhances our capability in terms of quality and quantity.
Yeah. So have you seen a difference in the volume that you've been able to do as far as surgery?
So yes, basically yes. And the nice thing about it is the volume that we do is quite a bit to begin with, which is one of the reasons we felt that pinch with the place we were in. So with the volume that we do currently, it's just so much more efficient.
Yeah.
So there's not near as much stress. There's no bottlenecks. Patients don't feel like they're waiting. They don't, it's kind of funny because they feel, some will say it's like cattle being herded. Well, the nice thing about cataract surgery is it's nice, efficient. We do it very quickly. And so we want to be able to get as many patients in as we can comfortably. And so this has allowed us a much better flow. So it's the experience. We will be able to increase our volume, and it'll be very confluent to where as we increase the volume, it doesn't seem like we're crammed or bottlenecked, and it takes the stress off of the staff being able to utilize all the rooms at the same time. We can have other providers like Dr. Coleman and I can both operate on a full schedule on the same day and not feel like we're on top of each other.
Yeah, that's
very
nice. Cool. So we kind of talked about this last time, but I feel like from maybe like a patient standpoint, this would be a question that I would have. But when you have, okay, so bear with me, cataract surgery, and you're putting in the new lens, what are the different options that patients, do they get to choose which lens is put in, or is that kind of up to your discretion?
It's a little bit of both. So the question for the patient is, what are your goals with your vision after cataract surgery? Usually that's maximum glasses independence. That would be a typical answer. So some people have job-related criteria. Let's imagine that someone's an airline pilot. I do a lot of pilots because I fly, and people come see me who work for the airlines. Or they're an over-the-road trucker. They drive for a living at night. Those are people who need maximum distance vision. That's someone that probably it's not a good idea to do a multifocal lens. We really want to make sure that they have perfect vision at distance, and if they need to wear readers to see up close, so be it. And then you have other people who say, really the vast majority of people in modern times say, I want maximum glasses independence. So then we're looking at all their measurements, all their objective testing to say, is there any reason you can't have a multifocal lens? The multifocal lens we use the most is the Panoptics. There's several of them out. I think that's the best one we've ever had. 99% of people with that lens achieve glasses independence. But the key with that is to make sure that you don't put it in someone who's not a good candidate. There's some specific measurement criteria that would make people a bad candidate for that lens. So we're sort of ruling people in for that, looking at their objective data. And if we say, yeah, you're a candidate for a multifocal lens, then typically we would go down that path. But then you have some outliers who've had previous refractive surgery like LASIK or PRK, or for some other reason have an abnormal cornea that we say it's going to be difficult to predict what your outcome is going to be. Those might be people we would use a light adjustable lens. And with the light adjustable lens, we get to adjust the power of the lens, the focusing power of it after the fact, once it's already in the eye. And that can be an advantage in a certain subset of people. And then we have people who have really high astigmatism, that they're not a great candidate for either one of those things. And we would just put an astigmatism correcting toric lens in to try to leave them glasses independent at distance. Then you have other small groups of people who have very specific issues. They've got scars, they've got other problems with the eye, and they may be a candidate for some other specific lenses that would give them maximum vision with minimum glasses dependence. But it's sort of tailored to the objective measurements of the eye and then the visual requirements of the person.
Gotcha. Okay, thanks for that thorough explanation. So Christopher is on the line. Thanks for joining us, and what's your question?
Yeah, Dr. Coleman, you did my cataract about 10 years ago.
Okay.
And I came in, I'm not able to see up close like at all. I used to be able to, but you told me at the time I was 32. You said I was the youngest patient you ever had that had them that bad. And I'm wondering, can I get can you redo them and do the color corrector or color lens?
Like a multifocal lens?
Can they be redone?
It is not impossible.
Yes.
And things have changed a lot in the last 10 years, to tell you the truth. We were probably about the same age when I did your cataract surgery. But I guess we're about the same age still, as luck would have it. So there are some options, and one of the things we could probably look at, if you're seeing good at distance but you're having trouble reading, is we could consider doing LASIK on one eye to put it in focus at near. I'd probably try you in a contact and see if you would tolerate that. If that didn't work, there's a few other options, but in general, the scope of what we can do has expanded a good bit in the last decade. So it would be worth coming in and just reevaluating the situation. So call the office and tell the front desk that we talked on the TV, and when it's convenient, come in and let's take a look and see if we can come up with something to get you more glasses independence.
Okay, will do. I appreciate it.
Yeah, absolutely.
And your number?
Okay, have a good one. Thank you.
It's 212-5901. And I'm sort of in the same location. We've just moved literally right next door over at South.
Okay. Thank you.
Very good. Thanks for the call.
All right, thanks, Christopher. And if you're just joining us, you can give us a call at 318-219-4569 and talk directly with Dr. Coleman or Dr. Shelby.
You know, that was a great question that he asked, and it's a subject we like to talk about, but not a lot of people understand, is that, so anybody who's had cataract surgery, even if it was at 32 or 72 or whatever, once they're all healed up, if they're in glasses but they don't want to be in glasses, and this is a lot of patients who did have surgery 5, 10, 15 years ago where we didn't have the technology that we have now, a lot of those patients are probably a candidate for LASIK. You know, a lot of folks think that LASIK is reserved for somebody who's 20 or 30 that just wants to be out of glasses or contacts. But our technology is so good and so gentle that we can do LASIK on a 70, 80, 90-year-old even, to correct nearsightedness, farsightedness, and astigmatism to get them more glasses independent at any time after cataract surgery.
Gotcha.
You know, whether it be to maximize distance vision or even monovision, like Dr. Coleman was saying, where we set one eye for distance and one eye for up close, we can get people out of glasses even if they had cataract surgery 20 years ago.
Yeah, that's good to know. And do you feel like that's something that you're seeing more of? More people are coming back to get the LASIK, or maybe they don't know that that's an option for them?
Yeah, most of them don't really know. Like when we have a patient who we do a multifocal or a toric or something like that, where we have an expectation that their vision's going to be good after cataract surgery, we know statistically that there's going to be about 4% that fall slightly outside of range. That's not much, but that's 1 out of 20, you know? So, I mean, that's 1 out of 20 eyes that may be a little bit blurry after we put let's say a PanOptix in. Once that patient is healed up, part of the package that we offer is a LASIK enhancement. So we will do LASIK on our PanOptix patients anyway, or toric patients, or Vivity, or somebody who has a certain expectation in their visual outcome. And that's one of the things that we offer is LASIK afterwards. Gotcha. So we do it routinely. And it's not just for our patients, but any patient out there, and that's what we want them to know, is any patient out there who's had cataract surgery and they are not happy with their results, let us take a look, because you probably are a candidate for LASIK.
So let's say someone is coming to you guys for cataract surgery and they do want to have the LASIK afterwards. So what is that process like? You do one eye at a time for cataract surgery, and then when would you do LASIK?
Typically that wouldn't be something that's planned.
Okay.
So we have excellent measurement equipment to say this, and we got a few thousand lenses in stock. So the trick to leaving someone glasses independent after cataract surgery is to choose the correct lens out of those options, the focusing power of the lens. So some of them have more focusing power, some of them have less. Measurement techniques are excellent now. Somewhere between 96 and 99% of the time, we pick the correct thing and it's perfect. But even with the best measurement equipment, people heal slightly differently. Some people still have a little bit of refractive error that would require them to have a glasses prescription to see 20/20 or 20/15. That's when we sort of guarantee LASIK. It's to say, if you're one of those people where we miss the mark, we will do a LASIK touch-up for free.
Okay.
So if you've paid extra money to get glasses independence, we will get you to glasses independence if you're a candidate for LASIK, and most people are. So it's not something we plan. That's just sort of the backup plan.
Gotcha.
Where if we say, our goal is to get you glasses independent. If you're one of the 1 to 4% who do not end up glasses independent just with cataract surgery, we will do LASIK on you for free to put you in focus at distance. Now, the people who've had cataract surgery a decade ago, before good technology existed, and you may have like a 50% chance of needing glasses back then. So we've gone from 50% to 1 to 4%, pretty good.
Right.
We're getting better all the time. But those people are still a candidate for LASIK nowadays, even if you had cataract. It could be 30 years ago, and they say, well, there was no options, you know, and I had an astigmatism before and I have astigmatism afterwards. You can do LASIK and get rid of it.
Yep.
Nice. Yeah, that's a great option for people. Well, Ann, thanks for joining us. And what is your question?
Okay, I have pseudo exfoliation. Could you explain that to me? And I know I have cataract, and I'm just scared to death to have the surgery, but what do you do with pseudo exfoliation?
Yeah, so pseudoexfoliation, it's interesting. So historically, there's exfoliation syndrome and there's pseudoexfoliation. And we see exfoliation in glass blowers, believe it or not, just because the intensity of the UV light actually causes layers of the anterior capsule to peel off, and so it has a specific look to it. Pseudoexfoliation is where there's some protein deposits, basically, that happen on the anterior capsule. And the issue, it's really not an issue. It can cause some pressure problems in some patients, but what we do is we make sure that the capsule at the time of cataract surgery is stable. So anyone who has pseudoexfoliation, which is very common, by the way, Ann, it's really nothing to worry about. At the time of cataract surgery, what we do is we put in a capsular tension ring, which is a little it's a PMMA ring that provides some tension to the capsular bag, which is what holds your God-given lens. And so once we have the cataract out, we put that little tension ring in, and then we put the lens in. Because patients with pseudoexfoliation are at a slightly higher risk of lens dislocation after cataract surgery. And so we try to help prevent that by using the capsular tension ring. The surgery itself is still the same. We sedate you a little bit. We use that ultrasound to remove the cataract. We clean everything up. We put that little ring in, and then we put your lens in. And so we do patients with pseudoexfoliation all the time and generally never have any problems whatsoever. And so it's understandable to be nervous about cataract surgery. It's understandable to be nervous about surgery in general. It's kind of like my dad used to say, it's all minor surgery. Unless it's on him, then it's all major surgery. You know, but that is really nothing for you to worry about, and we see that all the time.
Well, I also have a sensitivity to meds real bad. I've gone into shock and nearly died, and that's another fear I have too.
Sure, I can understand that. One of the benefits of where we are is we actually have an anesthesiologist who pre-ops every patient, and so they're very careful about going over the medication list, and we make sure we don't give anything that could cause any type of reaction based on your medical history.
And I have anxiety. Is there a way that I can have something where I'm not so scared, or I can be kind of calmed down just a little?
Sure, absolutely. You know, that like I said, that's very normal to be anxious beforehand, and some patients are more anxious than others. And a lot of times we'll write for an oral anxiolytic to take like the night before and even the morning of surgery. Because once we can get you through the door, then our staff is wonderful. They make you feel very welcomed at home. They ease your mind. And of course, we have tons of good medications to give to make sure that you're not anxious at all. Matter of fact, I've never had any patient afterwards that has said, oh my God, that was a horrible experience. Most everybody is very nervous coming in for the first eye. But it's astonishing how many people, when they come in for the second eye, they're excited. Their anxiety is almost non-existent because they know, based on the first experience, how wonderful it was.
All right, can I have like just a regular lens where I can wear the reader glasses?
Sure. You can have any lens you want as long as you're a good candidate for it. And that's what most people opt for, is the standard lens, which is optically perfect. You know, it's a wonderful lens. I mean, even with the standard lens, patients will see better than they've seen in a long time. You may have to wear glasses, but you're still going to see a whole lot better.
All right, now I have Medicare and TRICARE for life. Do y'all accept the assignment?
Absolutely.
On that?
Yes, ma'am. We actually accept everything.
Are you Dr. Coleman or Dr. Shelby?
I'm Dr. Shelby. Dr. Coleman's got a full head of hair.
Okay. He's got a what?
He's got a full head of hair. And it doesn't look like it's going anywhere.
Oh, okay.
It doesn't make me jealous at all.
Then you're Kojak.
Yeah, that's right. Yeah.
Oh, it's like y'all are out there at South.
So we have 3 locations.
Well,
We got South. That's where Dr. Coleman is primarily, and his number is 212-5901.
We finally remember it.
I got it. I got it. It only took like 10 years. I have my main location is over at Wilson Knight and Piermont, which is 212-3937. We also have a location at Wilson Knight and North, which is 212-2020. And whichever location is most convenient to you, you can call them, tell them you talked to us on KTBS, and we'll get you in very soon, probably next week.
Oh, how about, I hear there's a shortage on your IVs and all of that. Are y'all having that problem too?
Not an
a
issue.
problem.
Not an issue at all. No, ma'am.
We preempted that. We knew that
Oh,
was
good.
potentially a risk. So we don't use a lot of IV fluids in cataract surgery anyway. So basically, we're just not using an IV bag. We're just using a syringe with saline in it, so that we use less. We're trying to conserve, so we don't cut into other people's needs, because you don't really need IV fluids to get cataract surgery. Not a problem.
Okay, so do I need to come out there and fill out my application out there on South? How does that work? Does it need to go out there?
Yeah, just give us a call. Call the clinic, tell them we talked on TV, and they'll get you scheduled in. No problem. And
All right.
don't worry a
Thank
bit
you all
about that
so much.
pseudo exfoliation. You're going to do fine.
Yeah.
It's not a big deal at all.
Well, y'all just say prayers that I am scared to death. I'm scared of surgery anyway.
You're going to be fine.
If you come in and
Okay,
talk
well,
to us,
y'all
we will ease your mind. I promise. Either one of us. We're not scary, and the vast majority of our job is easing your mind and setting your expectations. So just come in.
Well, I
and-
worry because I live by myself. My children are both over there in Texas, and I'm here alone. And that's what I worry about. Is if I go blind in one eye, I'll be in bad shape,
We won't let that happen.
which I don't want to. Okay. Well, listen, y'all made me feel better already.
Good.
And thank you so much. I appreciate that.
Yeah, thanks for the call.
Yeah. Thanks for the call.
Yeah, thanks,
All right.
Ann.
Bye-bye.
And I'm sure that's a very common concern. I mean, surgery can be scary, but I love that you mentioned the first eye is always maybe more nerve-wracking than the second eye, and the second eye makes it, you're more excited for that. So we've talked a little bit about, beforehand, before surgery. Now let's talk about the post-op, what people can expect.
Yeah, I
with that.
had a request from a patient to talk about the post-operative care, because we on the show talk a lot about pre-op, and when we do, we have some videos we show patients in the clinic. So thought we'd go over a little bit of the post-op and like the routine post-op care. So use eye drops. Now, some places will offer dropless cataract surgery, where they put all the medicine inside your eye. We think that's a bad idea. That's riskier than just using eye drops. And if I was having cataract surgery done on me, if someone said, should I inject a bunch of medicine inside your eye, especially a steroid, or do you want to use these eye drops for a month? I would use the eye drops. So I have trouble doing to someone else what I wouldn't do to myself, and I would use eye drops. And we still do. I think that's the best way to do a post-operative course with cataract surgery. So there's 3 eye drops to use. One is a steroid. That is, we start at 4 times a day, and then we taper it down by 1 drop every week. So it's like 4 times for the first week, 3 times for the second week, 2 times for the third week, 1 time for the fourth week. Then most people, 95+% of people, can stop it. Some people need to continue it a little bit longer. We sort of tailor that to those people. Then we have what's called a non-steroidal anti-inflammatory. That's almost like Advil, except for it's a drop for your eye. And that prevents macular edema. Now, the disadvantage with that is it can cause irritation on the surface of the eye. People feel like it's dry and scratchy. Well, we put up with that because it prevents a worse problem, which is swelling in the retina. It massively decreases the risk of that, and we use that drop, 1 drop per day for 1 month. And then we have an antibiotic drop that's used 4 times a day for 1 week. So it's a little bit annoying putting the eye drops in. We always ask that people space them by about 5 minutes, so you don't wash one drop out with the previous drop. The common question always comes up, how many drops should I use? Well, your eye will only hold 1 drop. So like in your lower lid where the drops accumulate. So you can put 50 drops in, or you can put 1, and you'll get the same amount of medicine inside the eye. So eye drops are metered to always be 1 drop. The other restrictions are, we say don't lift anything heavy for just about a week. And that's just so you don't strain, because the wounds with cataract surgery self-seal. We don't have to put a stitch in them 99+% of the time. They seal completely by themselves. So we just don't want you to strain, because there's a theoretical risk if you increase the pressure in the eye enough that you could cause fluid to flow out of those wounds. Now that is really rare, and I always tell people it's real hard to mess it up. But we just say, once you've gotten a perfect, uncomplicated result from cataract surgery, take it easy for a week just to make sure it stays that way. So, there's the general rule is don't leave anything over 10 to 15 pounds, but that's sort of arbitrary. The main thing is don't lift anything where you have to strain. You know, so if you're a bodybuilder and you can squat 500 pounds, you know, maybe you could lift 40 pounds and it would be okay. And if you are not, then maybe if you lift to 10 pounds, you'd have to strain. The main thing is don't strain.
Right.
And then there's a common misconception that people are going to be in a patch, that the eye is going to be patch closed. With a routine cataract surgery, that is not the case. We give people a shield. It's like a plastic shield. It is only there as a reminder not to rub your eye, especially when you've had a little sedation from surgery. We don't want you to forget and rub the eye real hard. And then we don't want people to rub it in their sleep. So for the first week, we say, wear this shield when you sleep, just so you don't accidentally reach up in your sleep and rub it real hard. Again, back to those wounds that self-seal, it's theoretically possible to open them. You know, I'm not sure, haven't seen that happen in years. So it's very, very rare, but again, try to take it easy for a week. After that, do anything you want. I always tell people not to, if people do swim underwater, few people will swim for exercise with their eyes open underwater. I say don't do that for a month. Besides that, after a week, you can pretty much do anything you want.
Nice. Are there any symptoms after surgery? Any discomfort, pain in the eye? What could people expect afterward?
Actually, not a whole lot. You know, so the wound, we don't put stitches in like he was saying, so we tend to swell them a little bit just to make sure they're sealed shut. So some patients will have a little gritty, scratchy sensation, you know, for a little while, but it's generally doesn't last more than 24, 48 hours. There's a little blur initially, but by the next day, generally the vision's a whole lot better. Pain and blurry vision is abnormal. You know, so I mean, if you're 24 hours out and the eye's hurting, we want to know about it. You know? There are some things that can happen, patients can experience. You know, that dryness, the grittiness and scratchiness is very normal. You know, so it's not abnormal for that to even last for a week or so. You know, it's not going to be severe, but maybe a little grittiness, scratchiness, especially when they wake up in the morning or towards the end of the day. Some patients will see some flickering. And you know, some will describe it like when the fan spins around a light, they may see a little flash or flicker of light that'll happen in certain lighting conditions. That can be completely normal. New floaters or a change in the floaters inside the eye is also not abnormal to happen. These are all things we do want to know about, but the patients can see them. And there's an interesting phenomenon called a negative dysphotopsia, which is when, you know, of course, light comes in the eye and is focused onto the retina. Well, some of that light bounces around also. And so when the lens is healing in, some patients will see what they describe as a crescent shadow off to the side. That is a negative dysphotopsia. A lot of patients will see it, but it always goes away. I mean, very rarely can it hang around for a long time, but generally within a few weeks or so, that goes away. Those are very common. But as a general rule, it's like the next day, it's like nothing ever happened other than the fact they can see better.
Nice, yeah. And so the day of surgery, they go home, they're recovering from anesthesia, right? So like that whole day, you want to probably take it easy.
Yeah, you got to take it easy. You got to have somebody to bring you. Now, every now and then I have somebody who says, I'm very busy. Had a surgeon that I operated on. He said he had a lot of things to do. I don't want any anesthesia, nothing. And plenty of people do it that way with literally nothing. And, you know, we finished the cataract. I told him I was going to quote him often on this, that he said that was almost as bad as brushing my teeth in the morning.
Oh,
and so
without anesthesia?
Yeah, no anesthesia at all, nothing, just put numbing drops on the eye. And there's a fair amount of people who do it that way, that for whatever reason just don't react well. You don't have to have any.
But you are aware of, you know, what's going on. So
yeah,
that might be
you got to look straight at it. I always said if I live long enough to get cataract surgery, I'm going to do it with nothing.
What about blinking? Like
you have a little instrument to hold it up.
Okay.
So, you know, and it's, I don't know, people who have no anesthesia, that sounds terrible. Yeah, you can't time it between blinks. People who have no anesthesia usually say that was nothing. So
okay, well that's good to know.
Yeah,
I think I will take the anesthesia.
Yeah,
me too. He's braver than I am. You know, look, it's
if you can do it with nothing. If you can certainly do it with little IV meds.
Yeah.
So it's
it's
people who are nervous, like our caller.
Right.
It's not going to be a problem.
Gotcha.
You're going to do fine.
Okay, only 30 seconds left. Where can we find you guys?
TheCataractSurgeons.com, and then my office number is 212-5901.
And then 212-3937. But you can find all the information at thecataractsurgeons.com.
All right,
Great
good
site.
deal. Thanks, guys, for
Thanks.
coming in. And you can find this at ktbs.com/podcast or ktbs.com/healthline number 3.